Association is pleased to be able to be providing this presentation for you with our amazing expert speakers today. Just a little bit about the American School Health Association. Our mission is to transform all schools into a place where every student learns and thrives. We envision healthy students who learn and achieve in safe and healthy environments, nurtured by caring adults functioning within coordinated school and community support systems. Just a little announcement for you all in case you haven't received an email about this, but we are pleased to announce our virtual conference that is taking place July 19th, 20th, and 21st. This is a great opportunity for K through 12 and higher academia professionals to attend this conference to learn about and get information on supporting students and their health in schools. You can visit the ASHA website at the website listed on this slide for more information about what the sessions look like and for registration information. If you are a member, we're so glad to have you as part of our ASHA family. If not, we do encourage you to become a member, and here are some of the benefits of being an ASHA member: access to the Journal of School Health, continuing education opportunities, discounts on selected publications, and additional information and expertise through the conferences and a newsletter that comes out. And for our presentation today, I'd like to just give a little bio intro for our presenters, Desiree de la Torre, Julia DeAngelo, Mason Hines, and Sherry Kaiman. Desiree and Julia work at Children's National Hospital based in Washington, D.C. in the Child Health Advocacy Institute, who through leadership and collaboration advance policy and system changes to achieve health equity for all children. Mason and Sherry work at Resolve, a nonprofit organization based in Washington, D.C., who has expertise working with clients and partners to solve complex problems and develop strategic processes that meet their goals. And with that, I will turn it over to our presenters.
Oh, good morning, good afternoon, everyone. I'm just going to back up here to the beginning. Here we go. You heard about us and my team, and we're really appreciative of ASHA for hosting this webinar, and we're a big fan also of Advocates for Youth. So thank you, Mary Beth, for the introduction. First, we will just drop a poll to hear from you who's on the call today. Okay, I think we can probably stop the poll. We're almost at 90%. So let's see the results here. We have a good variety of folks who work in health education, administration, nursing, school health coordination, et cetera. So really happy to have you here today. So I want to introduce our learning objectives for today's webinar. First, we will talk about our Children's National Hospital history and our approach to building partnerships with our local school districts, as well as supporting them throughout the COVID-19 pandemic. Then we'll go into introducing our school-friendly health system principles, and we'll also talk to you all and learn from you all on what you think are the value contributions of health care to school and school environments and education. And, this webinar aligns with the WISP Framework's health services and community involvement components, which is the whole school, whole community, whole child framework. We also wanted to remind folks of the ASHA core beliefs. When we saw these promoted a few weeks ago through social media, it was another reminder of a great framework and belief system around school health. And we are looking closely at other frameworks as well. And we'll talk about that later in our slide deck. This quote help guides us by Dr. Jocelyn Elders, who's a former U.S. Surgeon General, and helps us remind us of the critical intersection of health and education. As you all know, children spend typically most of their time at school outside of their home. So it is vital for our healthcare systems to support student health and social needs. And we're hopeful that a school-friendly health system framework can help us guide us and align us to all the resources and efforts to be necessary in helping meet students and school needs. Brief background about our Children's National Hospital. We're based in Washington, D.C. We've been around for over 150 years, serving children in D.C., Maryland, Virginia, and beyond. The picture here on the left is our first hospital, or was in a row house downtown D.C. that had 12 beds. And now we're into the right photo, more northeast near Howard University. We have over 300 bed hospital and also primary care centers and specialty care centers around the Beltway. And we've been ranked many years in a row for #1 in newborn care as well. We have a care mission, which stands for clinical care, advocacy, research, education. And as Mary Beth mentioned in the introductions, Desiree and I lead we're in our Child Health Advocacy Institutes. We lead the advocacy of our hospital's mission. When I started our hospital about 5 years ago, myself and our team conducted a needs assessment to really understand what were the critical needs and issues that our hospital was working on in school health. So we interviewed our former and current school-based programs and initiatives. We talked to local school district. We talked to community-based programs and really asked, what are the needs and how should we be addressing those needs? And this resulted in 2 reports here. You can see the screenshots here on the slide here. And this is an infographic to describe. Currently, we have around 29 programs that cut across serving early childhood education to K through 12 students across DC, Maryland, Virginia, and approximately 200 plus schools. Those are diverse services such as direct healthcare delivery through our DC school nursing program, our school-based health centers in Maryland and DC. We also provide lots of education and research support around asthma management, mental health, child health safety, and other topics as well. And in 2017, we launched a School Health Collaborative. It's an internal working group to help connect and learn from each other and collaborate on our school health programs and initiatives. And through that work group, we've been talking about our school-friendly health system that really was birthed from that initiative several years ago. So for more information, you can check out the URL on the bottom of the slide. And as the world shut down about a year ago, our hospital and our primary care centers have still been open, and we've been eager to help and serve our students in our schools as best we can. The first thing we did is we opened up a COVID-19 testing site exclusive for children back in April of last year. And we've also provided information and resources about the COVID-19 virus and about how to actually help students and families, not just healthcare, but mental health care and wellness through community town halls and for families and for youth as well. So I will now pass it on to my colleague Desiree, who will talk about our school-friendly health system principles.
Great, thank you so much, Julia, and thank you to Asha and team for giving us this opportunity to share our experience in developing school-friendly health system principles. Julia just presented how COVID-19 has impacted our healthcare systems in schools across the nation and across the world. And COVID-19 underscored that critical linkage between health and education and that need to intentionally tend to that bond. And this presents an opportunity to learn and examine how collaborations between health and the school systems work together. But we've been working on this for a number of years. The school-based programs report that you can find at the link in the chat box that shows you what we've been doing over the last 20-some years in school health. And with that, we knew how important it is to continue to develop that relationship, but also what framework or principles do we need in order to help guide that work. And so over the last couple of years between Children's National and Resolve, well, you'll hear from Mason in a little bit, we've been working together to develop school-friendly health system principles to help hospitals and healthcare systems be better partners with our academic systems. And you'll see what our vision is in a little bit, but it really is focusing on not just the health part for children, but on the academics as well. And you'll see some of that through our themes that we've gathered. Next slide. Before we dive into the school-friendly health system principles, we'd like to take another poll. How closely does your school district or school districts engage with local healthcare systems or your healthcare systems? Oh, you guys are quick. Excellent. Fully engaged at this point. Oh, I can't wait to reveal the poll results with all of you. We're almost there. And if these answers don't resonate with you, please, if there's something else you'd like to put into the chat box, please go right ahead. We're almost there. All right, a few more. Any last minute ones coming through? All right, I think we have a good group there, Caitlin. We can show results. So it's a, almost even divide between we have close partnerships and we are building relationships. But there's still a few that we do not have any existing relationships and a number of you that say not sure. So hopefully through this presentation today, we can show how the school system and the healthcare system can work better together. Close this. And now for the next engagement opportunity here, if you can use in the chat box or if you like to raise your hand and share, describe in the chat box what a school-friendly health system means to you. What would a hospital healthcare system do to be a good partner to the school system? If you like to verbally share, just raise your hand and I'll call your name and we can unmute you, but please take a few moments to put into the chat box, what would a school-friendly health system mean to you? I know our school nurses who are here, you all have an idea. Please feel free to share. I think there was an administrator in there as well. Love to get your perspective. Chat box is open. Anyone who verbally like to share what they think? All right, there we go. There we go. Just had to overcome some of those anxieties. All right. So you see some coming through in the chat box there. I'll read them out loud for those who will be viewing this later. Collaboration of services between health systems with schools, whether simple communication or more specific services, excellent. Open collaborative communication that doesn't always cite HIPAA as a reason they cannot. Excellent response there from Lori LaChance. There would be a known point of contact and the school nurse can contact for working together, like coordinating on forms, getting spacers for inhalers, etc. Yes, definitely improved communication coming across all of these chats here. When hospitals and schools work together, they provide consistent and quality opportunities for students to learn and grow. I love it. Opportunities for mentoring for school nurses, especially around evidence-based care for students. Definitely making sure that our school nurses have the skills and support that they need in order to address both health and academic outcomes. Sharon, great to see you. Collaboration and communication about student health concerns to help students be healthy in school. Exactly. Well, thank you so much. Feel free to continue to put those into the chat box. Those will be shared later, I'm sure, but will be really helpful to all of us. And so some of you have heard of the BabyFriendly Hospital or the Age-Friendly Health System. The BabyFriendly Hospital came from the WHO. that's really focused on what do we do for our babies in hospitals, age-friendly, focusing how do we care for the older population, from the Institute for Healthcare Improvement. And so we learned from these types of best practices in healthcare systems that created these friendly systems, and leverage some of the learnings there to start to develop what we're calling school-friendly health systems. The benefit of looking at these baby-friendly and age-friendly is that they provided a framework on how do you approach this from a hospital healthcare system. And so some of this was able to help with cost and health outcomes. And so we're hoping that through this school-friendly health system work, we can do the same. And so now moving to our definition of a school-friendly healthcare system. One that we've envisioned together is a school-friendly healthcare system is designed to help all children reach optimal health and achieve their full academic potential. Again, focusing on the health and the academics of a child. And to do that, I mean, the vision is great. And our work within school-friendly work at Children's National for the number of years is terrific, but it just can't stay there. And so over the last couple of years with Resolve, we've been working together to understand that from across the nation, just like with all of you, what does that mean? What resonates with you? What are key qualities and themes that are really important to that? And today's conversation that we had in the chat box, and as we go through today's presentation, that's this kind of thing we've had over the last couple of years to get to where we are today. And so with that, I'm going to pass it over to Mason to talk a little bit about what we've done over the last couple of years. And you'll see that in the next slide.
Yeah, thanks, Desiree.
Here you are.
Yeah, I appreciate it. Thanks, Desiree. And thank you all for joining us. It's just been a pleasure to work with Desiree and Julia on this really important initiative. So I'm just going to spend a minute talking about sort of how we're approaching this project and beginning to put our hands around this notion of what it means to be a school-friendly health system. I always say that our methodology was very simple. Much like we're doing today, we talk to the people who know what they're talking about. So the first thing we did was pull together a wonderful advisory committee who helped shape this initiative, but also who pointed us to other leaders in the field. Our advisory committee included Attendance Works, Children's Hospitals from Wisconsin and Cincinnati, the AAP Council on School Health, Esperanza Health Centers, which is a FQHC in Chicago, Stanford University, and the DC Office of Education. So with guidance then from the advisory committee, Sherry and I conducted an interview scan of 21 national sort of experts or stakeholders across the country. And this included folks from health systems, so hospital administrators, pediatricians, health professionals, behavioral health specialists. It also included folks in education, school administrators, teachers, and others. And then folks really working at the nexus of both sectors. So people who run school-based health clinics, nurses, and perhaps most importantly, parents who are just representing themselves as parents. And we asked all of our interviewees a similar set of 7 questions, but really the gist was what we just asked you today. What do you see as the essential characteristics of a school-friendly health system? Which, as Desiree mentioned, we defined as a health system that strives to improve both the health outcomes of the children they serve and the academic outcomes of the children they serve. So we led that national scan and compiled a synthesis we heard into a summary themes report that once we completed, we shared back with our interview pool just to kind of close that feedback loop and ensure that what we put together resonated with our interviewees and was accurate to what they told us. It reflected their feedback. If you're someone who really loves reports, and especially reports with lots of sub-bullets, bullets and sub-bullets, really encourage you to read that full report, that resource, which we can share after this webinar. What we're going to talk about today are really the 5 top-level themes that emerged and surfaced from our analysis, which we can go to on the next slide here. The first was awareness. So school-friendly health systems are familiar with and responsive to the culture, policies, and needs of school systems. And the heart of this was really, do you as a health professional understand how you or what you do affects a patient's life at school? And a lot of this came up in really like tangible logistical things like if a kid doesn't have a certain form that a doctor needs to sign or the hospital needs to sign, how does that impact whether they can go to school or play sports? Do you as a provider know how many days your patients can be absent from school before it has implications for their matriculation? So there was just some like very logistical things, but there are also focused on awareness of school culture. So aware of the social stigmas around health, especially around sexual and mental health, and especially as we know in those teen and preteen years where that can be very sensitive, and how to deliver service, how to do health education, how to provide health care in a way that's sensitive to that culture and to the very real social pressures that exist in school settings. The other one was academic achievement. So school-friendly health systems consider how they can support the academic achievement of children at all touch points, understanding this extends beyond school-based intervention. So of course, there's the obvious in schools, we can be providing, we can provide services in schools to help them just get the services they need while in school. But there are also other ways, like when a student is outside of school, actually interacting with the health system, that the provider can start, can actually influence the academic achievement of the student. So asking them about how things are going in school at a checkup, or providing educational resources or services, especially for patients who have a chronic condition or are going to spend more time interacting or in a hospital or in part of the health system than your everyday child might. And also just seeing it as part of a health system's mission to support purely academic programs. So tutoring and reading programs, because we know that that link between the academic achievement of everyone and their long-term health outcomes is so strong. It's actually part of the health system's mission. You know, folks suggested that being school-friendly health system means considering promoting the academic achievement part of the work that you do in your mission. Next here is access to care. So school-friendly health systems provide accessible health services in a way that limits students out of class time. You know, this is probably like the no-duh one, or the most common sense things, but the best way that you can support a kid's success in school is to let them be in school. And so, you know, the folks we talked to really promoted things like telehealth services and in-school and in-class services. Another idea that came up several times was around like a hotline or quick consultation service for parents. You know, we heard that there are those mornings when kiddo wakes up kind of feeling off. If a parent can't quickly, you know, talk to a professional, they might err on the cautious side and keep a kid out of school, even if it's not necessary. And those absences can add up. And so some way for like a quick consultation, a little bit worried about ability to participate in school, can I just get some reassurance from a professional? And that's related to our fourth theme here, which is family engagement. Really hit hard in our interview scan, which was around school-friendly health systems build bridges to families, because, you know, a health system, again, sees that kiddo as a patient, and a school sees them as a student, but the parent really sees them as both. And they'll likely be the first ones to see if and when there's any friction between their child's health needs and their education needs. And so engaging them and really having linkages with family is a critical component of being a school-friendly health system. And then the last thing here is just alignment. It's the old adage around what gets measured gets done. And we did, you know, in our scan, there are examples across the country of hospitals and health systems who, you know, maybe it's through their community needs assessment, are setting goals around different education-related metrics. So whether that's third grade reading level in their community, or helping to keep health-related absences below a certain level, and actually building that into their into how they're evaluating their own success as a health system, even though it is an education metric. So those are some of the themes that really surface at the top of our scan. Again, we captured a lot of pretty rich nuance and sub-themes under each one of these points, and we encourage you to look at that sort of deeper scan. As Desiree was saying, we do want to keep this session interactive though, which is, always a little bit harder during Zoom and with a large group. So what I want to do right now is invite you to do two things. One, keep putting any questions or reactions that you have into the themes chat. The second thing we want to do here, and I invite everyone to do this, is to do this annotation exercise. So if you look at the top of your screen, you'll see a view options, and then you'll see an option that says annotate. And if you go there, you'll see a bank of different options, and one of them says stamp. And so if you go to the star stamp, you'll be able to put a star next to, for this first one, the question of which of these 5 themes do you view as the most important element of the school-friendly health system, or which really resonates with you the most. It's fine if you want to do more than one, but if you could just start annotating that just to give us a quick kind of reaction here. Great, seeing a lot of stars. Middle 2 getting a lot of love here. Academic achievement and access to care. Just give people another few seconds here to look at this. And what we're doing in the background is like frantically screenshotting so that we can capture these responses. So thank you for this feedback. And then someone really liked just the word element at the top there. So that's good. So I think we can move on. We're going to do the same thing, but sort of on the next slide, the reverse question, which if we can clear the annotations, which I think I can do. Oh, someone beat me to it. And then advance to the next slide. Which of these 5 themes resonates with you least, or gives you the most pause, or you have the most questions about? And for this, we want to use that X stamp. Bottom 2 around, or it looks like we're getting some X's on family engagement. Alignment. Just spend a couple, again, feel free to put things in chat as I see some people are doing. So as folks are continuing to put their stamps on the slide, thank you for doing that. I just want to tee up, hopefully, an opportunity for folks, having given initial reactions to some of these themes that we put forward, to surface questions or comments. Maybe it is just elaborating a little bit on why any of these themes give you pause, or why you had a preference for one. And we also have some discussion questions that are on the next slide. But I want to just encourage everyone to either put questions or comments that they have in the chat, or again, if you go to the reactions button in your Zoom toolbar, you can see the raise hand function. And we can also have you unmute your mic and invite you to ask a question or to make a comment. Chat is fine, but I have been trapped inside my house for 15 months. And so I would love to hear some human voices if we have any folks who want to make a comment. And maybe we can actually shift to the next slide here, which have some discussion questions. We can clear the drawings. So thank you for putting in some questions or some comments in the chat. Seeing, access to care is difficult for small, rural, remote schools, how to make it affordable for everyone. That's a really great consideration. Thank you. Other just discussion questions we wanted to put on the table and invite folks to offer thoughts on is around sort of what's missing. What other characteristics do you think are central to being a school-friendly health system? What do you see or have you experienced as the main challenges or barriers to becoming more, a health system becoming more supportive of a child's academic success? So again, welcome. So one of the things that certainly came up in in the initial sort of, this is what it means to be a school-friendly health system. And then I'm seeing in the chat here is privacy and those privacy laws, FERPA and HIPAA on both sides. And I just want to kind of speak to that a minute, because that was definitely something that, came through loud and clear in our, during our interview scan, which was how those laws, or at least the way in which people interpret those laws, can be a challenge, especially for cross-sector collaboration or cross-sector data sharing. And we know that for these partnerships to work, there needs to be communication mechanisms. There needs to be a way to share data. And we have found examples of school systems and health systems that have developed MOUs or developed mechanisms for sharing data that work within the confines of HIPAA and FERPA. Often it involves getting consent from families to do the data sharing, which we know can be its own challenge, but it's just one of the strategies people have used. I will also say that one of the things we often heard was that in both directions, just because maybe they don't fully understand one or the other, HIPAA or FERPA, that folks tend to err more on the cautious side, or more on the, we're just going to hold on to this data because we're not sure if we're allowed to share it. And so that leads to a more cautious interpretation of those laws, when in fact there may be more room within them to do data sharing.
Mason,
So,
one of the items in the chat box that was coming through is one, measurement. I think that's something that we've discussed in the past with other people. And then the other is COVID and some of the challenges that presents. So just thinking about COVID for now, we recognize that either COVID has helped in building some of these relationships because schools are asking hospitals and healthcare systems to help with the return to school and safety. And then there's the other part where someone mentioned also the mental health of our kids, one related to COVID and its impact on family loss, parental loss, loss of jobs, and how that's impacting our families. Some of the social justice and injustice issues that are in our community and how that's impacting mental health. That presents an opportunity for healthcare systems to focus on something that's critical for schools at this point, the social and emotional well-being of children. And so we see this as an opportunity to build that relationship with the school system. And when it comes to measurement, it is definitely an area we're interested in exploring further through these themes. And Mason will tell you a little bit about some of those next steps as we talk about measurement. And then those themes 1 through 5, one is not more important than the other at this point. There are themes that we've heard. And so there is definitely not one weighted more than the other.
Yeah, and then just responding to some other questions or comments that are in here. one is around just how there are resources available, but students or parents feel discouraged to use them, or maybe just aren't even aware that they're available. And to me, that ties back somewhat to that family engagement theme of really being intentional. I mean, it applies both in school settings and hospital or healthcare organization settings about building that bridge, building that link to parents and guardians and families so that, you know, when folks like us, and there are thousands of people across the country who are doing similar work to develop tools, to develop frameworks, to develop resources that are meant to support children, are meant to support families. When we do that work, that it actually finds its end user, it actually is useful to and gets to the people in the audience that it's meant to get to. And so, you know, I think both sectors really have a key role, can play a key role in facilitating those relationships and building those bridges and really engaging families in that way so that the resources that are available can get to them. Just want to pause just for one more second, allow any other questions to come through or comments to come through in the chat. We might be breaking the norm for these webinars a little bit by inviting people to raise their hand and speak, but one more opportunity for folks to do that before we move on. All right, I think we can probably go to the next slide. So what's next? Desiree was alluding to this. As you kind of saw, we talked to, you know, just over a score of different experts and stakeholders in our interview scan. So the method was very qualitative, and we got deep, rich input from those experts, but not very quantitative, not very broad or high powered. So we want to expand the number of folks that we're seeking input from on this topic, exactly like what we're doing with you here today. We want to also shift and refine and translate some of the themes. Right now, they're really formulated as just, okay, what are we hearing, into more of an actionable framework or suite of tools to support adoption and implementation of these tools, specifically because our audience is healthcare organizations for healthcare. So framing it in their language in a way that they understand, and talking about system transformation for that sector. And then the last thing that, you know, you don't know if you made something that works until you try it. And so we are really seeking to pilot and implement sort of this series of principles and then associated tools for living those principles in an initial cohort of early adopters in hospitals. And we are forming that cohort now as we're also in the refinement phase. Some of the things, and I think they're listed here on the next slide, some of the early things that we're hearing in our sort of phase 2 of this project as we're expanding who we're talking to and reaching out to more stakeholders is that the focus should be beyond patients. So this isn't just, you know, we don't want health systems to focus just on their patient population, but on the communities that they serve and populations. So using a communities and populations framing, a real emphasis on rebuilding trust in medicine. And, you know, some of the comments have gone further, not just in medicine, but in science generally, and how there's a perception that has needs some rebuilding of trust or restore confidence in those institutions. And you know, some of it is some of that trust building. There is it's really warranted and needed. There are instances in which healthcare system has certainly failed certain groups or populations, and that there's a real need to rebuild trust there. And then these, last few here are the time and communication and collaboration and tracking are essential to developing successful school-based health programs. And then the couple in the middle is sort of where we want to turn our discussion here as we close, which is around how the pandemic has really underscored and enlightened a lot of people on where there's need for further school and health system collaboration, or education and health system collaboration. Distance learning, we know, has been a challenge and consume bandwidth. But where there have been sort of strong partnerships, that those have been really important and instrumental in keeping schools open during COVID, or allowing, even if they're not open, allowing kids to continue with their education throughout this experience that we've all gone through. And I do want to spend a little bit more time on that last point, because we started this work in winter, fall of 2019, and we're actually wrapping up the survey, the initial survey that we did literally in like fall or in February and March of 2020. And so there was a little, folks remember this, but there was this period where, there was a sense that this was going to be a thing, but it hadn't really sunk in. And so I think that there's a real data gap because of when we ended that initial phase. Obviously, both sectors have undergone really previously unimaginable disruptions and have had to do adaptation, and actually learned a huge amount about the critical linkage between health and education. And we know that those new learnings need to be folded into our work. And so that is just kind of another piece that we want to close on here, is around collecting more insights on that piece from folks like you. I think we can go to the next slide around I'm sorry. I skipped a step that we're doing here in the presentation. Julia, do you want to just talk to this slide as we're talking about next steps still before turning to the COVID discussion?
Sure. So as we're calling it phase 2 of this project, really thinking about what does the theory to application look like, and part of it is to develop some assessment tools, et cetera. So we are in our scan, we're looking at other school health frameworks. These are a list of some of the ones we've been diving into and seeing how they've been utilized, what are the impacts of those. If there are other ones that you're aware of, we flag them for us. We'd love to share that in the chat, or follow up with us afterwards, because we want to make this as user-friendly and practical for our hospitals and healthcare systems. So that's all I have to say about that.
Okay, thank you. Sorry for jumping ahead there for a second. But our last discussion question here, and again, welcome you to put thoughts in the chat or raise your hand and speak, is just around, as we are all collectively recovering from the pandemic, and especially these two sectors that are probably among the ones that have been most disrupted, where do you see opportunities to strengthen the bond between health and education, and introduce new paradigms to both sectors around that linkage and around the necessity to collaborate as part of the rebuild process? So just welcome, pause again for thoughts in the chat or discussion on this. And Desiree and Julia, I don't know if while folks are thinking, either of you want to just mention some of the things that we've heard from others as we've asked this question, some of what we've heard as we've been touring this.
Sure, and as I mentioned before, thinking about what return to school looks like. For some states, they have just starting to return to school. Others we recognize have been back in school for many months, and so we can learn from those. In our own community, we have been working with the healthcare systems in our region, not just in DC, but in our region, and what that looks like, and partnering with the health department and the school systems to help students return to school. And an example of that is just helping our teachers get vaccinated. A few months ago, Children's National led a vaccination of all the teachers in DC. And so that's just one way of, again, the Children's Hospital stepping up to say, here we are to support our educational system, making sure kids are being able to go back to school in a safe environment. And vaccinations was just one way of doing that. And just most recently in the last couple of weeks is getting kids over 12 years old vaccinated. So there's definitely opportunities as a result of the recovery from the pandemic on building those partnerships.
Thanks, Desiree. Julia, anything to add to that?
Yeah, I think an obvious reality that we've been faced with is understanding there's a lot of social injustices and racial inequities in our populations and families, and we are critically looking at that as well as whatever framework we finalize, having language and kind of helping assessments to help healthcare systems really critically think about that, about what are the issues, what are the highest need populations, school areas, et cetera, because we know resources are limited and even awareness is limited too as well. So I think it's something we've been hearing from many stakeholders. We can't ignore even racism's impact on health outcomes. So we're definitely taking a closer look at that as well as we develop these principles and the toolkit.
Yeah, and I think that's related to the point that we've started to hear and some of the feedback around rebuilding trust in health systems. Of course, there have been longstanding health inequities and outcomes, but I think became, just more visible, top of mind for a lot of people when you look at, vaccine distribution or access and those kind of things. And so again, that kind of comes back to this idea of rebuilding trust as an institution and as a partner. Just lifting up a really good point that's here in the chat, which is around one of the outcomes has been like a COVID coordinator as a school position, and how that might transfer from beyond COVID to just the liaison or bridge person between the health sector and education sector. And that is another thing that really came through in when we did our interview scan, was that having that point person and that dedicated staff, not just, it can't just be part of everyone's job. It needs to be all of one person's job, at least one person's job, to focus on school partnerships or to focus on being a school-friendly healthcare organization. And the same is true, I think, in education, but having that point person or that liaison, I think is just a really strong part of being a school-friendly health system and being a good partner to schools and patients.
Mason, I'd just like to read this one message in the chat box.
Yeah.
I think it's Virginia. Virginia says, because of our that their district is so remote and rural, their county health department really stepped up to support the schools during COVID. Partnerships with health departments and healthcare systems and school districts are so important. Health departments are often underutilized because entities tend to work only within their silos. That's so true. And she says we need to work together.
Yeah, again, it's Matt, I ultimately see, the work that we are doing with the School Friendly initiative as part of sort of a broader transformation in the way that healthcare systems see their role, and the way that we, deliver, focus on healthcare and the health and well-being in our country. Again, trying to break down those silos so it's not, health system, you're doing this, public health, you're doing this, community organizations, you're doing this, schools, you're doing this. So understanding that, really fostering wellness in the community and in a society is interrelated process. And so the linkages there across all sectors have to be really strong. And so the partnership and collaboration, I think, is really being driven as a core component of what health systems should be doing or need to be doing, but also other sectors should be looking to be doing those partnerships as well. So thanks for lifting that up.
One thing as we are sharing our comments in the chat box, and Mason, as you share some of your thoughts as well, one of the things that occurs to me is as we prepare for return to school, there are two items that our hospitals are concerned about, our school systems are concerned about. One is immunizations. We know our kids have probably not visited their doctor because they were afraid because of COVID. So they may be behind on immunizations for return to school. So that's going to be a critical piece on the healthcare side. The other is absenteeism and school engagements. We know that because many schools were going into the digital or virtual learning, that many kids weren't able to participate or attend school. And so we don't know what return to school looks like and how the absences will be an impact in the coming school year. So those are from both the academic and healthcare side, I see as something that we need to be aware of.
So thank you all for just participating with us here today, putting some really good content in the chat. We welcome further input. So if you have your phone handy, you can do it right now, or if you have your mouse handy, you can click on the link that Julia just put in the chat to just take a more formal survey and provide feedback on some of what we're finding about what it means to be a school-friendly health system. If you don't have time right now, we'll also circulate this link in the follow-up for this webinar. But I just want to say thank you for spending time with us today. Really appreciate you listening and adding feedback. And I'll turn it to Desiree and Julia for any closing words from them. And then I think we have some closing words from Asha.
Thank you, Mason and Sherry, for your leadership and support throughout this process over the last couple of years. We could not have done it without all of you. And Julia and myself are super excited to be with all of you, Asha, and your members to share this information with you, get your feedback. If you're interested in learning more, Julia's email address is definitely there. Please reach out to us. We are looking forward to continuing this conversation past this webinar. And I'll pass it to Julia because she is definitely the reason why we're here. She found the opportunity, and Julia, I'll give you the opportunity to say the closing remarks.
Well, thank you all. I hope it's not the last time we hear from you, and please reach out to us. Please share your wisdom and what you've seen in your schools and your communities, and we hope to be in touch with our next steps soon.
Thank you to, thank you to all of our presenters. Julia, if you wouldn't mind, or if allowing me to share my screen for a moment. Thank you so much. And I think we sort of covered with our presenters. If there's any questions, you know how to reach them. And they placed the survey in the chat box, which is super important because this session is eligible for continuing education credits. And our members have the ability to receive free continuing education credits. And in order to receive those CEs, you do need to complete the webinar evaluation. So while it's great information for the experts to get back from you, that it's also an opportunity for you to get some continuing education hours. And you can see for your participation who is offering those credits. And then finally, be on the lookout for more webinar presentations that are coming your way from Asha. You can see that on the website. Or if you have any questions or would like information about the conference or how to access webinars from the past or what's coming up in the future, please email us at info@ashaweb.org. Other than that, I wish you all a great afternoon. I'm going to check the chat just to make sure we didn't miss anything. Any final questions? Yep, Desiree has the SurveyMonkey link there. But wishing you all a pleasant afternoon. And hopefully all of you are getting a little bit of an extended weekend for this holiday that is coming up in a couple days. So thank you so much for joining us today, and be well.
And I do want to clarify, the SurveyMonkey link is actually not the link for today's webinar evaluation. That will be going out in an email that you should get this afternoon. So stay tuned for that email where you can do the webinar evaluation. You're welcome, Nicole. Thank you, everyone. Oh,
Thanks for that clarification, Caitlin.
no, you're fine. Thank you all so much and have a great day.
Thank you.
Bye.